Okay, so first I want to show my audience. And now I will start. So, my name is Raven Atkinson. The purpose of my speech is to bring awareness to anxiety and depression that start at a very young age for children. My thesis statement is it possible for children of young ages to experience anxiety and depression? So 7.1% of children between the ages of 3 and 17 are diagnosed with anxiety. 3.2% of children between the ages of 3 and 17 have been diagnosed with depression. Young children can experience different types of anxiety and depression. They can also gain these disorders from childhood trauma and fear. Intense forms of fear and sadness can form anxiety and depression. When children do not outgrow their childhood fears, it starts to interfere with their daily, everyday lives and daily, everyday activities. They begin to be diagnosed with anxiety. The different types of anxiety disorders are separation anxiety, phobias, social anxiety, generalized anxiety, and panic disorder. Anxiety symptoms are trouble sleeping, fatigue, headaches, stomach aches, anger, worry, and fear. With depression in children, it starts to show when the child is not showing interest in the things that they would usually enjoy, or when they start to feel helpless in situations that they know they can change. There are two types of depression: major depression, which can last at least 2 weeks, and then dysmia, which can last 2 years. Children who have parents with depression are at higher risk to get depression. So like alcoholism, depression can be genetically transmitted. Some behaviors in children with depression are feeling worthless, sad, hopeless, not enjoying fun things, changes in eating, sleeping, and sleeping patterns, and changes in energy. This can all lead to extreme depression, which could lead to thoughts or plans of suicide. A way of treatment is talking to your children's healthcare provider or a mental health specialist. Trauma is the main cause of anxiety and depression. There are not many ways to development of anxiety and depression that can be treated the same way and at the same time. They can be treated with cognitive behavior therapy and antidepressants, which I personally do not recommend for children. Depression and anxiety can start at a very young age, but it's very important to stop it before it becomes something that you cannot stop at all. I also believe it is every person's job in that child's life to work together to help that child. So like parents, school teachers, nurses, group leaders, just every adult or every friend in that child's life. I believe it's everybody's job just to work together to help and change the course of the way that child's mental health is going. Children developing anxiety and depression need the support the size of a village, just so they know that there is somebody there to help them through such trying times.